Senator Baldwin.
Thank you, Mr. Chairman, and thank you, Dr. Means, for being here today. You spoke in your opening statement about building trust in public health. And you also made, I think, a passing reference to conflicts of interest within agencies in HHS. So I want to ask you a few questions on that point. Dr. Means, you've promoted a lab testing company, Genova Diagnostics, which is backed by private equity and may charge customers several $100s for its services. Before you began promoting their tests on social media, the company agreed to pay $43 million to resolve allegations that it had billed for medically unnecessary lab tests and violated the False Claims Act. You personally accepted $10,000 from this company, and I want to ask you whether you were aware of Genova Diagnostics' prior violations and the settlement when you started promoting their services.
Thank you, Senator Baldwin, and also thank you so much for meeting with me beforehand. I really enjoyed our conversation. Frankly, I was not familiar with that settlement.
So that's
there's a particular test that they make about nutrient quality that I find very compelling because I do think we need to understand a little bit more transparently about how the nutrients from our food are affecting our health. And I would just highlight that I have worked extremely closely with the Office of Government Ethics over the last several months and taken this process very seriously. I've signed a letter that outlines how to rectify any potential conflicts. And I
know you're going to divest your
absolutely
stocks in all sorts of health-related and non-health-related entities, but it's troubling because the Surgeon General must be someone that the public can trust, and someone who does their homework before accepting money or lending credibility to a company. And for me, this raises questions about your judgment. It does not inspire confidence that you're here to make Americans healthy when you accept money to promote a company who's had to pay a settlement because of violating the False Claims Act. Dr. Means, you have also promoted a range of supplements, including those that claim to promote longevity and detoxification. You made at least $325,000 from promoting supplements since the beginning of 2024, according to information provided to this committee. This includes nearly $135,000 for a so-called longevity supplement and $46,000 for wellness teas and elixirs, both of which can cost upwards of $100 a month for somebody consuming them. Your company, Levels Health, offers continuous glucose monitoring and AI-driven health insights. And a full membership, and I'm not sure what all a full membership involves, but costs $1,500 a year. And that's about a whole month's average rent for a one-bedroom apartment in Milwaukee, Wisconsin. So do you really believe that most Americans can afford to spend upwards of $1,500 a year on your supplements and programs? And is that one of your solutions to our nation's health problems?
Thank you for the question. I certainly don't think every American needs to be wearing a glucose monitor. I think that we have a monumental blood sugar problem in this country that underlies most of the leading causes of death in this country: dementia, cancer, diabetes, heart disease, stroke are all connected by metabolic dysfunction, elevated blood sugar. And my work on using entrepreneurship as a tool to bring and study new tools that can help us understand our blood sugar better, I believe I'm very proud of. And as I mentioned in my opening statement,
thank you for that statement and those observations, Dr. Means.
And that research that we've done with the company is meant to benefit all Americans. It does not necessarily mean that
that's what I want to tie up in my remaining 12 seconds. Dr. Means, you say you want to address chronic disease, but 1/3 of low-income adults have 2 or more chronic conditions. They need an affordable solution. Groceries are too expensive. Healthcare is too expensive. Health insurance premiums have skyrocketed because of Republicans' refusal to extend the tax credit and cuts to Medicaid. 15 million Americans are losing their health insurance. People cannot afford their prescription drugs. So you've said that our healthcare system is broken, but it seems to me that you've spent your career sort of making money off the flaws in the system, and I'm left wondering how the American people are supposed to trust you to put their health and safety first, not profits.
Those are incorrect characterizations. I appreciate your comments, and I do look forward to working with you and on your priorities. And I absolutely am committed to giving Americans the best public health information possible. And like the comments I made prior, I think some of the movement in our administration towards making healthy food more accessible are going to impact all Americans in a very positive way. And I look forward to helping on that and many other issues that make healthcare accessibility much easier for all Americans.